Bob Morrison asked me to present a little bit what we have been the evolution of our protocol program, what type of change we've seen, what we have learned from the process we have done from the start to now. So basically, Seaboard Farm is composed of 47 farms that make about 217,000 sows. As of today, 46 out of the 47, or 213,000, are infected with PED. We have one farm left, and basically with that farm, with the setup that we have, we basically have not any type of protection to protect it. So it's flow as first farm in, but you don't have any segregation to the feed mill, and they even have start receiving positive gilts that are exposed. And still the farm remain negative. So sometimes it's baffling on what you put all those barriers and they fail, and sometimes you give up and nothing happened. But to go back, basically when we look at our initial break, we had about 125,000 sows that broke in the early phase of the disease when it was first diagnosed and went through the Guyman area and pretty much infected us and all the other company in a matter of a few weeks, and we had 125,000 sows that break in that period. And also in their Colorado area, that was the first break in early May. Then in November, it hit just east of there, where we had we have 13,000 sow farm, and all those were infected following a neighboring farm get infected. And then in 2014, in the spring of 2014, we had two other cells that got infected, the northern part of the Colorado system and our cell 1 east, or where our multiplication is. So initially when we start, we basically say that virus is like TGE, so we'll don't take the same type of approach with TGE, which is a load, close, and homogenize approach. And we basically wean all piglet 10 days of age or older into an off-site facility. Then we introduced the gilts to shut down the unit, and then we did an exposure program. And initially we were really focusing on getting exposure well done and do very aggressive exposure using basically one piglet intestine for 10 sows and doing those exposure at numerous times, thinking we really have to improve that immunity. And then once we did that, we also start exposing sows and gilt 2 to 5 weeks pre-farrow with scour material, thinking that we need to maintain the immunity in those animals, and maintaining that uniform immunity produced by the sows to the piglet. And when we did the exposure, we basically did very aggressive 3 times in a 2-week period. And the number of sows, though, that when we look at the diarrhea and the thing, were very variable, and in the 40 to 90% of them. Using that program and experience, as most farms come back to a normal pre-weaning mortality within 5 to 6 weeks after the exposure. But unfortunately, we had about 70% of the sows that went to a pre-weaning mortality that was not back to what 70% was normal, but 30% were either rebreaking or never come to the normal phase. Basically, the herd that break in the second wave of infection, merely in the November period, and at that time I would clarify that we were not doing any type of post-farrowing exposure. Those farms never went back to their normal production. So I've put the slide that Bob Morrison presented initially, looking at the wean pig throughput baseline and when the herd would go back to a normal production. When you look at those slides, oops, wrong button. You see that for most of the herd that they described, it took quite a while for them to get back. You get that usual curve that they go back to about 80%, and then it took a while for those herd to get back to their 100% throughput base. When we look at our entire company, we did better than that. What we've seen is that usually around that 6-7 week period, we were back to about 90%, and then we kind of inch our way back, but struggled because of some of those rebreak farm. And it was very a different pattern depending about the different farm we're dealing with. The cell 4, which are smaller farm in the Guyman, Oklahoma, those farm to that initial protocol respond extremely well, where they went to the exposure program and basically went right back after 6 weeks to their normal production. And there was really taking the TG type approach. When we look at the cell 2, where we did the exposure, those went right back to normal, but after about a 10 weeks period, and other people have reported the same thing, we start seeing chronic diarrhea reappearing and be able to, and isolated PED out of those farms. And we were doing, at the time we were doing pre-farrow exposure. Cell 4 were doing pre-farrow exposure and we didn't see any issue of rebreaking. We start seeing some there. We had another cell where we didn't see also any issue with the re-exposure, but we decided to stop the exposure thinking that there was maybe an issue to trade contamination in those farms. Then cell 6 is the one that I've break in December and in November, and when you look at those, they basically went to that chronic phase, never went back to normal, and take a very, very long time to get back to acceptable performance. The question that came when we look at that, what is the cause of those endemic sow herd? We initially were taking was a failure to induce complete herd and protective immunity. And but we were seeing that in some farm where we had done like 15 feedback, and we're still seeing that. And I said, there's something else that we're dealing with there. And more we believe strongly that we're dealing with a waning herd immunity coming with a higher than normal virus challenge. So that immunity is waning, and we not have done a very good job early on to clean those farms up. And what we think are the risk factor that we have identified was a limited herd closure or not take long enough to bring gilts that have not been exposed to the virus. If you were the gilt exposure on site, we think was a risk by keeping virus activated diet and having sows that are actively shedding at that time. The size of the farm, none of the farms that we see when chronic were smaller than 5,000 sows. All the smaller sows went right back to normal production. Colder temperatures definitely looked at that the series of break that we see in the fall and the winter have more chance to get back into a chronic stage than the one we saw in the spring or in the summer. And relate to design farrowing house that are walk through rather than an hotel style, meaning that you walk outside and get in the room versus the room that animal will go from one side to the other directly. We have seen more issue with those farms getting endemic than cleaning up the virus. So the basic lesson that we learned from what we have lived in that first phase was that basically PED is not TGE. So what we apply as the TG program that we think was good enough don't necessarily going to work for that. Then various exposure is the easy part. We probably put way too much importance on that aspect and overdone it rather than looking at the cleaning part and the process of reducing shedding. We think that one of the key that you have to understand is time is not on your side. Your immunity will get as high as it's going to get 3 to 4 weeks after you expose that. After that, it will start going down. There's the clock start ticking, and you've got between that 4 and that 10 weeks to get rid of it. And time is not on your side, and that's probably the thing that would emphasize the most. Virus replication, it's a very high level, especially in piglets, so don't allow that virus to replicate. Don't let that environment get super contaminated with virus. And the virus is highly infectious, so you need to bring hygiene to the next level. So applying those rules, we basically have changed the protocol. So in all the break we got in the late winter and spring, what we did differently was basically to, as soon as a herd is diagnosed positive with PED, we basically wean everything that we think will survive in the nursery and move them to the nursery immediately. Then we euthanize all the remaining piglet that are at the farm. Then we have produced an inoculum at the lab that we know contain only PED, and we know the dose, and we use that to inoculate the sows, and we do all sows 3 times with a spray on the nose and get them administered within a 5-day period. Then, after that, for a 21-day period, we euthanize all the pigs at birth. Not 14, not 18, 21 days. And talking with other veterinarians, a lot of people will say, yeah, the 21 days appear to be pretty important to be sure that you don't see virus shedding after that. So it was quite a big thing to stomach for people to say you're basically going to eliminate 4 weeks of production when that break starts. But we got to see if that protocol will work and if we're going to be able to get those farms back to normal production quickly. Then we start immediately to whitewash all the farrowing houses. Not allowing sows to stay in those farrowing houses also are important to don't contaminate them. If you expose them, you don't want to keep a sow shedding in the farrowing crate for nothing. Move them in the gestation if you can. And then on top of that, we want to have all the chance on our side. So even if they were exposed and when their immunity was very high, we decide to add a PED vaccine on top, administer just 1 week pre-farrow to try to get that immunity as high at the end of the lactation phase, because that's where we were seeing usually a little bit of clinical sign appearing in those early phase. So basically we did that in the last 10 herd that break. 10 out of those 10 herd on the first pigs we weaned, we didn't see any diarrhea in those pigs. They basically went and went out. 8 out of the 10 were non-clinical and negative on the first group of piglet that were not euthanized. So they not only they were not clinical, we didn't find any virus. 10 out of 10 were producing negative piglet 8 weeks after initial exposure, and none of those farms re-break after that. So but when you look at the curve of comparing those two, the green being the new protocol, the blue being the old, the appearance don't necessarily look fairly drastic, but combining all the farm that did good and the farm that did bad, even with that, you see that although you have a little bit higher mortality initially because you still have, if you let the pig live, there would be a little bit of those pigs that would make it to the nursery and end up dying there. But then you get into that area and be able to get back to your 100% production a lot quicker in those farms and be able to maintain that versus dealing with endemic issue that can create you risk for the rest of your system. A quick point on the gilt exposure. I don't want to dwell too long, but in our system we decide to basically, because we could not control the disease, to get into maintaining a herd with high immunity and producing negative pigs. So gilt exposure was the key. So our goal is basically to develop a gilts and give her enough time to see the virus, develop immunity, but not shed when they bring to the sow farm. As I was saying, in farm 64, we've been now for 3 months and know of system that have been doing it for over a year or bringing exposed gilts into negative farm and have not caused disease issue in those farms. Basically what we do is we expose those gilts by doing a spray, a nasal spray, then a water dose, and then we do a second exposure about 4 weeks before they get out of the exposure site. Our exposure protocol are based on group of gilts that are disseminated to several farms, so they will get into an exposure site, then go into a cool-off site after that, and then before they are shipped to the sow farm, they will be tested by oral fluid to ensure that they are not shedding any virus at that time. And as long as we ship pigs out of those farms, they will be tested. Still, some issue with those protocol is, especially in the winter, we're going to find some virus present sometime. Not at the, let me rephrase that, not virus present, but we see PCR positive in the between 30 and 35, and the issue is that those are truly virus or contamination. Most of the time we're going to hold the gilts and retest them, and the next week they will be negative. This is also we basically hold female if we see any type of scouring in them at the time of shipment. Seeing 1 or 2 sows scouring in a barn of 800 is a fairly frequent event. So it will happen very often that people will call and say, I got 1 sow scouring, what should I do? And so, okay, let's hold shipment, let's test, come back negative, that's good, they're good to go. Those are not extremely often, but they will happen fairly often. And you need a level of oversight when you look through that, and you need to develop it into a system so everybody know when exposure happened, when testing need to be done, what decision need to be made, and you need to have your delivery system, your people scheduling, and all your people on your GDU site know what the hell's going on and how they need to respond to those processes. An aspect that I want to cover quickly also is dealing with endemic herd. When those herd rebreak, those are a little bit more problematic to deal because you have population with different type of immunity. We want to increase immunity at this time. Vaccine will help. Virus exposure may be necessary, especially for gilts. I'll cover a little bit more the gilt issue later on, but when we see reactivation of the disease, we mostly see it in gilts. Even if those gilts have been exposed to the virus during their growing phase, it appears that they have an immunity, but they don't have formed a very good production of IgA if the udder is not formed, and they don't just, when we look at mortality, the big group of our mortality is associated with those, and if you expose those gilts pre-fero to the virus, they produce a strong immunity. So there's an element of timing of immunity, of exposure in those gilts that make that thing could be problematic. So we usually go reduce the pressure of infection, and we basically try to do a bubble debop in unidirectional pig flow in those farrowing house, try to move that virus out and reduce the pressure of infection. And then the question comes, and that's the harder one sometimes, is that how do you reduce virus replication? Because you're going to have some piglet that will scour, you're going to have mortality that raise, and you say, okay, what do I do? Which pigs should I euthanize? Should I euthanize any? Should I euthanize everything? And we have basically trialed different approach, and we have seen some farm where we just did the unidirectional pig flow without euthanizing anything and been able to clean those farm up. Some did not work. And then we went into some of them and euthanized pigs, and at-risk pigs. So in some of the farm, we euthanize all the gilt litter. And some of the farm, our manager in the farm were seeing that usually in those endemic farm, the gilts that we're having, or the litter that we see scour for rotavirus around 3 to 4 days, were exactly the same litter that would scour at 13, 14 days with PED. So I had a very high correlation on that. So in 2 or 3 of those farms, that's what we did. We basically say, if the pigs are scouring at 3 days of age, euthanize them. And that has been fairly successful to eliminate the virus in those farms after that, in combination of that. Then there's the element of looking. We were at the stage that we were looking, we may need to go and re-expose those farms and boost the immunity by using live virus rather than using a vaccine to have a more robust immunity. And then we did a trial to kind of evaluate that. So as I was taking, the gilt remained the problematic animal. That's the animal where we see most of the scour, and that's the animal that we see the diarrhea happening. Those animals have been exposed, but they were not exposed pre-fero. They were vaccinated with a kill vaccine, but they were not exposed with a live virus pre-farrowing. And even though you look at their FFN production, they seem to produce an immunity, but for whatever reason, it doesn't look that they protect as well. So we designed a trial where we basically take gilts that were exposed as growing animal and put them in an isolation farm and expose them using 3 different doses of virus between 10 to the 4 to 10 to the 6 that extrapolated to the CT value of our control inoculum. And then we basically measure their response based on FFN and also looking at their shedding period and how long those animals would shed. Try to understand what risk that would represent related to reactivation of the disease in the farrowing house if we would use live virus to boost immunity in those endemic herd. What was interesting that we see is basically that the dose of the vaccine matter on the immune response of the animal shown by FFN. Basically where the titer on animal that used 10 to the 4 were lower compared to the one where we used 10 to the 5 or 10 to the 6. So if you look at average mean, the 10 to the 6 represent a dose of FFN titer of 1280 versus 960 and only 240 for 10 to the 4th dose. When we look at clinical sign, not a whole lot of difference, and basically all the signs were sporadic and resolved within about 7 days after we exposed them. On the fecal shedding, there was a little bit of higher shedding in the animal that will use higher doses, but basically by day 17 and 20 day post-inoculation, it disappeared. So even though those animals have seen virus, if you give them a dose, they will shed that virus again, but for a shorter period of time. So basically when we look, fortunately for us, all those farms that we were doing the process clean up by the time we got the results, so we never had to use that strategy. But if we had reactivation or endemic herd that we had to approach, we probably would look at the selective Gilt Exposure program and getting that exposure done around the 4 to 5 weeks pre-farrow. In conclusion, I would say that right now all our farm are producing negative pigs. Our farming house are 100% producing negative pigs. If we look as a country, the number of cases have dropped significantly in 2015. There's still a significant number of herd that are infected. And just last week and this week, in our system is a little different than what you see anywhere else in the States. Most of our finisher circulation usually have happened in the early fall. And this year, again, in our finisher population, we have about 5 or 6 new cases of PED that have started about 2 weeks ago. So that virus is not dead. And we just need to be very vigilant and not think that we have won the battle yet.